to all of you to our weekly webinar. We're racking them in now, Sammy. I think we're getting up there in the numbers, and so thank you for all of you who have joined us on this journey for so long. It's nice to see so many faces, and so welcome. We have a great webinar ahead of us today. We have Sammy Moon, who is our Executive Director at the Alliance. We have Lloyd Gray, who is the Executive Director at the Phil Hardin Foundation, which is not Lorena Quiroz. I don't know how that got on there, so I'll tweet that, sorry. David Buys, who, this is quite the long title, works for the Department of Food Science, Nutrition, and Health Promotion at Mississippi State University's Extension and College of Agriculture and Life Sciences. David, I don't know how you fit that on a business card. I've got to see it because that's a lot of text. And we have Casey Colbecker, who's the Hub Director for the Hub in East Mississippi with Volunteer Mississippi. So welcome everybody to the Alliance's weekly webinar.
Good morning.
Good morning. As is our regular practice, we are going to start with a moment of silence to mark lives that have been lost due to a variety of circumstances right now, very unfortunately, from COVID to racial inequities and some real challenges that our country is trying to make its way through and learn from and grow from. And so I hope that this is an opportunity for all of us to learn and listen and grow and reflect and take action when necessary. And so with that, let's go ahead and if you'll join me on a moment of silence to mark the lives that have been lost. Okay. So with that, we're going to go ahead and pivot into our first presentation. You know, there is a lot of really important work being done across the state right now in terms of medical response, in terms of trying to capture important data, in terms of trying to keep people safe. But one of the other areas that there's a lot of work being done, which is probably not going to be too unfamiliar to most people in this room, is around education. I was just talking to some friends in Nashville not too long ago, and they too are trying to figure out what does this coming year look like and how do we meet the needs of our families and children. And it is a very, very complex question and challenge that has a variety of hurdles, including the digital divide. And so I think there are a lot of really intelligent people working very hard to try and find a path forward for Mississippi in education and in particularly in response to COVID, but also how we try to make some important moves forward regardless of COVID, and just looking at how we make sure that we are always setting up our children for the best possible future. And so with that, the Alliance has set up an education affinity group that Sammy is going to talk about in just a second. And we have our chair of the affinity group, Lloyd Gray, who I said is the executive director of the Phil Hardin Foundation, who will be able to speak about how we approach this work and how we are trying to play a role in supporting our state as we look at how to respond to the educational impact by COVID-19 and how we continue that work beyond. And so with that, I'm going to turn it over to Sammy and Lloyd to tell us about what we got going on.
Great, thank you, Dave. Really glad to be here this morning and glad to see all these smiling faces on the webinar or the virtual meeting. It seems like we're living in a virtual world now, right? I'm delighted to get to talk about this because it quickly is becoming what I think is going to be a cornerstone for the Alliance. And I'm going to kind of give you the context of how we have arrived at where we are now, and then you're going to get the real good part of the presentation when Lloyd takes it over and talks specifically about some of the work that the Education Affinity Group is doing now. And that way you get both kind of the history that got us here as well as the present situation and where we're going in the future. So that's our plan. Let me start out to say that this work in thinking about affinity groups and what role they might play and where they might fit within the structure of the Alliance actually started before there was even an Alliance. It goes back to the days when there was the Mississippi Association of Grantmakers doing its work with Philanthropy, and there was the Center for Nonprofits doing their work with nonprofits. And it was through the Mississippi Association of Grantmakers that, we began to look around the country and talk about what are the structures that other associations have put in place that seems to be the place to go to actually get work done. We had focused pretty intensely and carefully during the first year of the Grantmaker Association, MAG, I'm going to refer to it, Mississippi Association of Grantmakers. We had focused pretty intensely on increasing the programming and building a network of relationships among funders in the state. And that was through a series of quarterly meetings that had very substantive programs going on. And we saw that people were indeed willing to come together and learn together and share together. And what we realized after seeing that there was a need for that kind of coming together and learning and sharing, we needed more than just a quarterly meeting to make that happen. So like I say, we looked around the country to see what other people were doing. And this idea of affinity groups was one that was pretty common in grantmaker associations around the country. And basically, most places have them as issue-focused affinity group, so that there's a group of funders that are looking together at education, or a group of funders that are looking at health, or a group of funders looking at other issues. We started out that way as well with the Education Affinity Group, because we had a group of funders who were interested and expressed an interest in coming together on much more than just a quarterly basis, but coming together to learn what each other were doing, learn what the role of philanthropy is in education, talk about how philanthropy fits in with the public sector and MDE and other education efforts in the state, how and where are there gaps that philanthropy might play some role in closing those gaps. So they quickly decided that if the Alliance would be the catalyst for bringing them together, that there was a strong agenda that could be developed around education. So all of that to say that the Education Affinity Group actually started under the old Mississippi Association of Grantmakers. The other affinity group that started during that time wasn't an issue-focused affinity group, but it was a role-alike affinity group. So the community foundations, all 7 community foundations in the state, came together and said, we want to form an affinity group of community foundation people across the state, because we need to stay on top of what's happening in the world of community foundations. We want to know what each other's doing. We want to share information. All of the stuff that I just said about the education group, we were getting the same thing from the community foundation folks. So the Alliance formed a community foundation affinity group. Actually, MAG formed that group and began to provide staff support to bring the community foundations together. And I'll talk quickly in just a minute about their major accomplishments. So all of that to say, a structure had been put in place when the merger occurred between our two organizations. So it was pretty logical. If it was working, let's keep it going. So when the two organizations went out of business and the alliance was formed in April a year ago, those affinity groups came over to the new alliance, and we have continued to provide staff support for both of those groups' work. I should also say early on, Woodward Hines Education Foundation stepped up to the plate and was willing to put some money on the table to build the MAGs and then subsequently the Alliance's capacity to provide the staff support to the education affinity group. So we are always grateful for WHEF, Jim McHale and his team for their willingness to support that important work. So all of that to say, it morphed into the Alliance when the merger occurred and has continued to be an integral part of the structure of the Alliance. And those are the two affinity groups that are still active and going strong. Our intent is to build our capacity so that we can add more affinity groups, because I have always believed, and I think Lloyd would agree and the Community Foundation folks would agree, that the affinity groups really are where, I always say it's where the sausage gets made, because that's where we have the opportunity to really go deep on an issue. And the quarterly meetings, you know, we're going to have wonderful conversations and we're going to learn stuff and we're going to have great people come in. But it's really through the affinity group work that we can go deep on an issue or on a topic or on a program that we want to work on together. So it's really about collaboration and how do we do work together. It's about what is not getting done now that should be getting done. And it's about what role can philanthropy and nonprofits play in addressing whatever the issues are that need to be addressed, and how do we do it together. So it's a wonderful opportunity to come together, to learn together, and to make something happen. Now, the challenge and where we are at this particular point is, one, having the capacity to expand. The next two affinity groups, I think, will be a health affinity group and a workforce/jobs training affinity group. After that will come an arts and culture. And you may say, well, how did you make the decisions on what comes next? That's because if you look at where the majority of philanthropic money is going in the state, those are the issues that are getting the most resources. And we're hearing from both nonprofits and philanthropy that these are the issues that are high on our agenda. It doesn't mean that there are all the issues out there, and it doesn't mean that we won't ultimately take on more affinity groups, but I think those will be the expansion plans for the immediate future anyway. So that's why education came first. It's getting the most attention in the state. It's getting the most philanthropic resources. Most nonprofits are involved in some degree of work around education. And so that's where we started. I'm real quickly, and then I'm going to turn to Lloyd. I do want to mention that the Community Foundation Affinity Group, in their initial work, Teresa Erickson came in one day to the group and said, I've heard about this effort somewhere else where a legislation was passed to provide tax credits for endowment giving. Do you think we might make something like that happen in Mississippi? So from that initial, do you think we could do this, the Alliance and the Community Foundation Network came together and over a 2-year period ultimately ran the process, did the engagement, did the work that had to be done so that there is now in Mississippi tax credit legislation to encourage endowment giving through community foundations. So that just tells you the substantive work that can be done and that can come from affinity groups. So that kind of gives you the context, the background. Lloyd graciously agreed to chair the Education Affinity Group and has been a wonderful chairman to move that work along. So let me turn to Lloyd now so he can give you more information about the Education Affinity Group.
Well, Sammy did a great job of setting the context that informs our current work, and I would say that we have had a long evolution. It's been a process of kind of determining who we are and what we want to be. And as Sammy said, in the early stages, we were just trying to learn more about each other, and we actually spent a good bit of time having the various funders just talk about their organization, what they did, what they funded. We plotted out a pipeline, education pipeline in the state, and who was involved where. So just a lot of information sharing and learning about each other. And then we got into some in-depth sessions on an assortment of issues beginning 2 or 3 years ago with well, I guess 2 years ago, with a look at kind of reinventing education, people who were doing it here and there. And some of it involved some of the stuff that's going on right now. Some of it was different. And we looked at, we spent a good bit of time on early childhood. In fact, that was an area that we were moving toward really trying to do something with, an initiative with, before COVID hit. We did a lot of discussion about the accountability system in Mississippi for K-12, its shortcomings, to say the least. And we just became, over time, more of a learning group than anything else, but we also still had this desire to have an impact beyond just being more in touch with each other and learning more about the issues that Mississippi education faces. And as with so many other things, this pandemic has really been a catalyst for us to sort of find our voice as an affinity group, and by extension, the Alliance, in the education realm. And you should know that right now in the legislature, the legislation that is being considered to essentially, well, comprehensively address the digital divide, the digital inequities in Mississippi that have been the light has been shone on during this period, really began, at least the framework for it began in the Education Affinity Group of the Alliance, when Kelly Butler with the Barksdale Institute reached out to a national consultant, Paige Johnson, that she had known and worked with, to see if she could help in providing a, what would it take cost model to ensure that every student, every K-12 student in Mississippi would have access and would have internet access at home and would have a device. And this cost model was produced, and of course it was not limited, the impact not limited to K-12, it's also very much related to higher ed and opportunities there for students who face the same challenges of inequities and lack of access. And so when that model was developed, we got in touch with the Mississippi Department of Education. The superintendent, Carrie Wright, was basically got right on board with it, brought her tech people in, had we had several convenings with her and her team. So we were beginning to have a role as a convener, as a resource, as a consensus builder. We had some other virtual sessions where we brought in the Lieutenant Governor, where we brought in the chair of the Board of Education, Jason Dean, who's now a member of the governor's Restart Mississippi Commission. So we were bringing people, and we found we were helping to bridge communication divides. Some of these people weren't talking to each other, and we actually facilitated communication because there were a lot of different plans emerging out there. And then the Brandon Presley, the Northern District Public Service Commissioner, came in, was brought into the group to share his ideas about the electric power associations becoming involved in extending access in the rural areas. And so a lot of this, I don't think it's an exaggeration to say that a lot of these interchanges with these various policymakers would not have happened if it were not for the affinity groups and the alliance's role in bringing all this together. So we've had some bumps along the way. We have issued two statements, right, Sammy? One broadly that this moment with the CARES Act funding, the federal funding that's come in, the 1.2 billion, is a one-time opportunity to address this digital divide. And we said it doesn't need to be piecemeal. As I think Brandon Presley said, we don't need to be just throwing a few Chromebooks at kids and saying we've solved the problem. It needs to be comprehensive. It needs to address access as well as devices. It needs to address training. And we put out a general advocacy statement that said, this is the moment, we can't let it go by. We need to address this issue statewide and comprehensively. It doesn't need to be done on a piecemeal basis. And then, and that went to the key policymakers. Then we, a couple of weeks later, I guess, Sammy, we issued a statement of principles that went to a broader audience and was done on behalf, if I recall, that's on behalf of the Alliance itself. And, you know, it outlined the reasons, several core principles, all of which I've referred to in moving forward. So right now, as Sammy said, the sausage is being made. We don't know whether it will taste good or taste bad, or there be any sausage at all come out of it. It might be an empty plate, as Sammy and I were going back and forth yesterday, trying to out clever the other with our statements about the sausage. But it would not. I'm confident in saying that without that effort that began with Kelly and the Barksdale Institute, and Jim Barksdale has been involved behind the scenes in some of this as well, that we wouldn't be as far on this path as we are. It may come crashing down, but I think it has shown us that we can be an advocate without being overtly political or overtly lobbying. We can, and of course we can't as who we are, but we can be an advocate for something as important as bridging this inequity in the digital learning process in our state, and urging people to take it on and being a resource, a very important and valuable resource. And ultimately, it may be that in fact, they've got us plugged into some plan for $7 million from Philanthropy. I'm not sure that's doable, but there may be a pooled resource of Mississippi and even outside Philanthropy at some point to help push this initiative along in some form or the other. So I think it's all very exciting, and I think what has happened with us, with the education affinity group, is in some ways similar to the Community Foundation group finding its voice on Endow Mississippi, and it's been a very worthwhile process, I think. Sammy, does that cover it?
It does. I have two things to say to wrap up, and Dave, then we will move on. But the first thing is that while we've described it as the place where sausage gets made, I think the affinity groups are also the place where philanthropy and nonprofits come together to jointly make that sausage. We started out with, like I say, with just philanthropy at the table, and the time now is to expand those groups to bring, particularly the issue-focused affinity groups, to bring nonprofits into the fold as well. So the vision is that it's not just funders sitting at the table, but it's those who have an education agenda in the state sitting together and figuring out where we go and how we do. So the sausage gets made, but it's a collaborative sausage that gets made. So that's where we are at the development at this point. The final thing to say is that there is a policy. The board has adopted an affinity group policy, and there should be a link to that policy, which is spelled out on our website. So if you want to see what it takes to establish an affinity group, click on the link that Dave will provide so that you can see what the steps are to go through in setting up an affinity group. So that's it.
Wonderful. Thank you, Sammy and Lloyd. And I know that we could spend many hours just diving into this as we have. And so I want to open it up to questions, comments, but I'm going to have to limit it to probably one or two. Feel free to enter them into the chat. And I know, Lloyd, that you're tight on your schedule, so if you need to head out, we can always send those to you and get your feedback and reply that way. But I also know Sammy is able to answer as well. So if anybody does have any comments or questions, please feel free to do so now. I do see one coming in from Marianne Placencia. For nonprofits serving the immigrant student population, are there currently any philanthropies that are doing this work in our state? That is a very specific question to the group. I don't know, Lloyd or Sammy, if you happen to know off the top of your head if there are any specifically.
I don't right off the top of my head. I would say also on our website is the 2019 philanthropy report that goes into detail about what philanthropies in the state are funding. So, we should take a look at that report and see if there's any indication in there of funders that are funding in that arena. So that's where I would go. I don't have it at my fingertips, but that's where I would go for the info.
Great. And then we have a question from Jan Eastman. As children are using technology at very early ages, is the group looking at expanding this to pre-K and kindergarten and later for early childhood learning?
Well, I think right now the moment is, that they're $250 million is the price tag on the K-12, which again helps with higher ed, helps with telemedicine, that kind of thing. I'm sure that, and I'm sure that access, which will be there, will be helpful to pre-K as well. In terms of a specific plan about devices for kids at pre-K, I don't think there's anything on the table about that right now. But don't misunderstand. I mean, this providing access into portions of the state that don't have it is going to benefit a whole lot of folks well beyond K-12.
Absolutely. So feel free, everybody, if we have more time at the end, I can try and ask those questions then. And of course, you're always welcome to send us those questions and we can get them to Lloyd and Sammy for answers. Lloyd, thank you so much for taking the time to be here today. I really appreciate it very much. And Sammy, for you as well, taking the time to provide your voice, although you have joined us every week. So we're always happy to see you here and have your input. And I will just reiterate what Teresa Erickson said in the chat. Keep up the good work. Let's make sausage, all in this together. Amen, Teresa. And so sausage on. With that, I'm going to do a little intermission here and continue to highlight, because I am the program director and this is my baby and this is what we've got to do, highlight our sessions coming up. So I've zoomed in on our offerings for the next few weeks, next couple of weeks. You'll notice tomorrow we have a quick bite, which is a lunch and learn series on tips on reopening in the age of COVID. And then we also have coming up on Monday, your boarding crisis and how to handle adversity. Those are the most upcoming. Please, please, please sign up. This is some really amazing content by some amazing people. And of course, you can sign up for the other trainings as well. We'll pop the link in the chat, and you can certainly visit our website, alliancems.org, to do that. And again, I want to highlight two important things. Number one is that our training rates have dropped. It is the same for members and non-members. If you sign up for one training, it's $25. If you sign up for two, it's $40 total. And if you sign up for 3 or more, they are only $15 per training. That is true almost 99% of the time. However, during this 1% of the time, we have a special deal, right? We put on my car salesman hat or whatever is appropriate, wave a banner around. If you sign up in the next hour or so for 3 or more, one of those 3 is free. So please, please, please take advantage of that. We really want to make sure this content gets out there and you all have the support that you need to be successful during this time. So that's all I have to say on the programming side. Sign up. And with that, I am going to turn it over to David Buys, who, again, I will read the full title, forgive me, Department of Food Science, Nutrition, and Health Promotion at MSU's Extension and College Agriculture and Life Sciences. David, how do you, like when you introduce yourself, how do you do it? How does that work normally?
I shouldn't have even said all that. I usually just say I'm the state health specialist with Extension. I'm usually in a forward-facing mode like I am today. That's all pretty much internal jargon. So you can disregard that and just know me as the state health specialist with MSU Extension.
Great. Well, welcome. We're happy to have you here. So tell us what's going on in our state in COVID.
Yeah, I'm happy to. Do you mind giving me sharing rights so I can walk through?
Yes, absolutely.
That's okay. Yeah.
And there you go.
All right. All right, so you all should be able to see my slides now. What I'm going to do is just walk through a few high-level ideas that the Robert Wood Johnson Foundation has presented on in a document that I believe Dave has made available to you all on health equity principles for state and local leaders in responding to COVID-19. It's something certainly that we all can think about as leaders in our community. I will then walk you through some data and kind of give you a high-level overview of where we are in Mississippi, and then wrap up with a comment or two about how we can think about our role in COVID-19 response specifically. So to start with, I want to just do a little bit of leveling, and the framework that I'm operating from is this one of health equity. This idea that everybody has the opportunity, what we're aiming for is the idea that everybody have the opportunity to attain optimal health regardless of race, ethnicity, gender, income level, or other social factors that create barriers to health. One of the program directors at Robert Wood Johnson Foundation was giving a talk at a conference I was at a few years ago, and he put it in real common terms I thought were really helpful. He said imagine that all of a sudden at this one point in history we learned that everybody in the world needed shoes. An equality perspective would say, let's get everybody a size 7 pair of sneakers. But we know that not everybody would be able to fit into a size 7 pair of sneakers. For some people, they would be too large. Some people wouldn't even be able to think of getting their feet in those. Folks in sub-Saharan Africa might do well to have something like sandals. Folks in Native people in Alaska might need boots. So wouldn't be a very good approach for us to take. But if we took an equity perspective, we would say, let's get folks in their respective climates and by size, the shoes that are appropriate for them. So that's what we've got to aim for as we think about addressing health disparities in Mississippi. And in particular, it's important for us to think about and keep this equity lens on as we address COVID issues. And so Robert Wood Johnson Foundation, as I said, I want to be sure that y'all know these are not ideas that are unique to me, but I found them to be immensely helpful in guiding my work, and so wanted to share them with you. One of the first things they talk about is the importance of collecting, analyzing, and reporting data that's disaggregated by race, age, race, ethnicity, gender, disability, neighborhood, and other sociodemographic characteristics. And so as I move in just a bit to talking about the data in Mississippi, I'm going to walk you through my personal journey in looking at data in the state and how I've been able to break some of it apart as MSDH has done a better job as they've moved forward in providing more granular data. And so you all, as leaders of nonprofits and philanthropy, grant-making organizations around the state, may think about who your target audiences are, and either look for that data that is specific to the audience you're serving, the clients you're serving, or if it's not there, think about ways to advocate for that being included in the breakouts that are coming from our public health experts. Some of the categories that we want to look at, of course, are age, sex, race, healthcare workers specifically. We want to look at those in congregate living facilities, those with underlying conditions, and by geographic location. And I have to give MSDH credit. They really are checking the box on most of these. It's not being provided in a way that we can, on the back end, as folks interested in data like myself, slice and dice it, but they're working very hard to at least provide a baseline level of information by all of these subgroups. Another principle that comes forward for us to think about responding to COVID-19 is the importance of including in the decision-making the people that are most affected by health and economic challenges, and benchmark progress based on their outcomes. And of course, we can't benchmark their progress if we're not looking back at, number one, documenting data, documenting outcomes according to those specific areas. It's also important that we think about not just looking at the outcomes, like who gets COVID and who dies from it or who recovers from it, but that we also look at things like testing, looking at access to PPE, personal protective equipment, looking at do people have safe places to isolate if they do test positive. We know that one of the reasons that we see such awful disparities by race in Mississippi is because we know that in our African communities of color, there are more people living in multi-generational households, and that they don't have the opportunities to isolate in the same way that folks in more white communities or Caucasian communities have. So that's just one example of the importance of paying attention to the nuances across our subpopulations. Additionally, we want to aim to establish and empower teams that are dedicated to promoting racial equity and response and recovery efforts. As it became more apparent in Mississippi that we were seeing racial disparities in COVID-related outcomes, the Black Caucus in the legislature came together and put together a letter to our state health officer, Dr. Dobbs, and they did a remarkable job of coming together to, again, provide more granular details so we could look at how this data could inform us about what's happening across race, as well as brought more people of color to the top of the decision-making table at MSDH to help guide our response and recovery efforts. But in our own communities and through our own organizations, it's important for us to keep this top of mind as well, ensuring that we have diverse teams that represent the people we serve. of course, across all of our programs, and even especially in this time of COVID-19. We can proactively identify and address existing policy gaps while advocating for further federal support, as well as state and local support. And then being, of course, that you all are represent grant makers, you may also think about those private philanthropic opportunities and efforts to address some of the needs that we're seeing. I've also, already heard this morning on this webinar ways that you all are being educators. I guess we have to be careful about the role of the line between advocacy and lobbying and educating our policymakers. And it sounds like you all are already got a good start in this direction of educating policymakers on opportunities. And so we can continue to do that around COVID-19 as well. And then invest in strengthening public health, healthcare, and social infrastructure to foster resilience. That's again an outflow of this advocacy, this education that we can do around COVID-19, advocating for changes in policy, for more equitable policy, for more and better funding, and then also again just to connect the obvious dots. As grant makers yourselves, thinking about how you might tweak what you're investing in right now to ensure that COVID-19 related issues are being covered in a way that's consistent with your mission. So some questions to ask as we move forward would be: have we identified a person or a team of people to apply an equity lens to all of our COVID-19 response and recovery efforts? Have we identified vulnerable populations and targeted outreach, as well as intervention specifically to those populations that employ national, culturally, and linguistically appropriate services and standards? Have we issued any guidelines that foster health inequity, and then obviously correcting those to ensure that we're promoting health equity? And then collecting, analyzing, and reporting and using demographic data for COVID-19 testing, hospitalizations, and deaths. And I'll be glad to share these slides with y'all. I don't think I gave them to Dave ahead of time, but I'm happy to get these to y'all in a way that you can access them. So I want to just walk with you for a second through my journey of looking at the data that MSDH was providing. One of the things that MSDH is not doing on a daily basis, while they provide the updates on cases and deaths across the state, they've not taken that a step further and provided rates of case rates, as well as death rates and case death rates, or case mortality rates, and population death rates. So I was very interested in seeing where we were as a whole across Mississippi, and then by different groups. And so you'll see that in April I started. This was, I think, the second or third of these analyses that I did. Just real simple. Pulled in the population data from the census and was able to generate some rates. And so you can see that we at that time only had breakdowns by African Americans and whites, and total cases and deaths across the whole population. We saw pretty soon after that they started giving us an other category, because we know, of course, that Mississippi is not exclusively comprised of blacks and whites. We have a fairly diverse population here, include other people, so people from other backgrounds, and this at least gives some lip service and acknowledgement of that. Then a few days later, they started including persons under investigation, people who had been tested but for whom there weren't results back yet. So it was important for us to start acknowledging that. Then fast forward a week or two, and you see that they started giving us information based on the American Indians and Alaska Natives, which in Mississippi, this of course referred primarily to the Choctaw people, as well as people of Asian descent, and then an other and unknown category. So MSDH, just to pause for a second and give them credit. They really hit the ground running and have been, as the saying goes, building the plane while trying to fly it. And have done a remarkable job responding to the needs and providing additional data as their infrastructure has given them the as they've been able to develop the bandwidth to do so. A couple days after that, I was pleased to see that they started giving breakouts according to long-term care facilities and long-term care facilities in addition to the total population. So let me just go back and point something out here. What you see in this data on May 7th across the whole population suggests that the case rate in the population was more than twice more than twice as high in African Americans or the Black community than the white community. And as well, the population death rate was more than twice as high in the African American community than the white community. But the case fatality rate was higher in the white community than the Black community. And so I was scratching my head trying to think, why have we got such an awful disparity in the case among the cases in the population and then the population death rate? But when we look at case fatality or case mortality rates, we have a higher rate in whites than Blacks. I didn't include this in my introduction, but I've done quite a bit of training in gerontology, and that's really my first love academically is work around gerontology. If I was to hone my public health interest, it would really be I only did one thing. It would be around the gerontology world. So I put my gerontology hat on and I started thinking it's got to be the long-term care facilities. We know that we've got a higher percentage of whites or higher number of whites in long-term care facilities than we do Black people and people of color. And we were hearing that the outbreaks were significant in long-term care facilities. So as MSDH again progressed further and began providing data on long-term care facilities, what I was able to do was to break out what was happening both at the total population rate, the long-term care rate, and then the with some subtraction, easy math, I was able to break out what's happening just in the community. So when you take a look at these data, what you see is that the numbers are all in the same direction. So we did in fact see that the rates, well, excuse me, that they're not all in the same direction, but we did see that this was the long-term care facilities is what explained that anomaly in the total population. So so the case fatality rate is in fact higher in nursing homes for white people than for people of color. In contrast to the community, which excluded the long-term care population, you see that in fact African Americans are more likely to die from COVID-19 than white folks. So again, this is a anecdotal, to Mississippi and not nationwide, but it does underscore that importance of giving attention to what's happening in these subpopulations and across settings. We can't paint with a broad brush and understand exactly what's going on. Fast forward a little bit, had a colleague at Jackson State in the School of Public Health who was interested in the data I was presenting and wanted to jump on board. So he started helping us provide these charts to give us a better visualization of what's happened. Another colleague at Mississippi State here has been interested in working with me to show trends, and so she has started providing this trend data. This is all available. We were doing it daily. We've now dialed back to Tuesdays and Fridays, providing these updates, available on my Twitter, Facebook, and Facebook page. As typically I post them as well in the comment threads on MSDH, the MSDH's releases as well. They have now broken down even further, to their credit, the data by residential care facilities and long-term care facilities. The long-term care facilities are those nursing homes. Residential care facilities are places like mental health facilities where people are in residential care, but they're not nursing homes. So we're doing a little work with the data now to try to get a population. We've got to have a denominator to be able to calculate rates. And so we're working on getting that denominator for these residential care facilities. And so in the meantime, we're back to just presenting total numbers. But again, we know that this is not the best way to paint the picture. We just didn't want to stop. We don't want the perfect to be the enemy of the good. So as I come to the end now of my presentation and move to open questions, I just wanted to comment on a couple things related to our organizational opportunities in COVID-19 response and recovery. I mean, the first thing I want to mention is the importance of contextualization. So pivoting our organization's work to address unique issues that our constituents or clientele face because of COVID-19. In Extension, as I said, I'm the state health specialist for Extension. I know that our role is not to be a mini MSDH or a mini CDC or a mini World Health Organization. So what I've been saying since the onset of COVID-19, and we've really ramped up our work around this in this space, it's that we've got to contextualize our expertise for the crisis at hand, not try to replicate what our state health agency or the National or World Health Organization are doing. And so I would just say that that's something to think about, as I'm sure you all already are. How do you contextualize what your mission is already for COVID-19 response and recovery? And then just a comment, you know, I say this as much to myself to hear myself say it. It's okay not to be the leader in COVID-19 response and recovery. We live in a leadership culture where leadership is hailed and touted as you know, as the ultimate goal in our work, but sometimes we need to think about followership and what does it mean to be a good follower. So followership, just a definition that I've found and like to think about when I consider what it means to be a good follower, is that it involves putting the needs of others in front of our desires and building a relationship of trust and loyalty to our leaders and our team. And so it's important in this time of COVID-19 to think about how do we take a step back, maybe not try to advance our original agenda, again, contextualize our expertise for service to in service to COVID-19 response and recovery. And remember that we can't all be leaders all the time. In the time of coronavirus, many traditional leaders are being usurped by new voices, and that is okay. It's fine for us to take a step back and find a way to support the work of those that do need to be on the front lines and at the podium, at the pulpit, speaking on this issue, and for us to take a step back and work in the background in support of those efforts. So with that, I will pause and be glad to take questions from any of you about my data, about this health equity, these comments on health equity. Again, this report is available for you all, and I will be happy to engage with you now. And put my comments already, my contact information already in the chat box, and welcome you to email me or tweet me, call me if I can be of help.
Thank you, David. I am very impressed. Trying to get a lot of data out succinctly and clearly in 15 minutes is quite a feat. So thank you. This is incredible work and incredibly important as we try to look at how we can try to understand what's happening right now and play our roles where we can and where it's appropriate, either as a leader or a follower. And so thank you for doing this presentation. I do want to acknowledge that it is 9:54, so we are running pretty close on time here. So what I would say is if anybody has a question, please enter it into the chat, and we can always make sure that we connect you with David. And again, his contact information is in the chat as well, and we can copy that again and make sure that we repost that for you. So with that, David, again, thank you so much for that great presentation and very valuable information and work that you're doing on keeping up with this. With that, I'm going to turn it over to Casey Culpepper to tell us what's going on in East Mississippi.
Hello, everyone. It's Casey Culpepper. I hope all of you are doing well. I'm glad to be the Hub Director for East Mississippi. I began this journey in March of this year. My coverage area includes the counties of Lauderdale, Clark, Jasper, Kemper, Neshaba, and Newton. I'm from Meridian. My family and I live right outside of Meridian in Bailey. The East Mississippi Hub is housed in the United Way of East Mississippi office. I enjoy this position because I'm passionate about bringing people together for the greater good. I truly believe we are stronger together, and that is how we make change happen. Prior to joining the Hub Network, I worked with other statewide nonprofits, and assisted in implementing marketing campaigns with the focus to help Mississippians. Relationship building has been one of my favorite parts of this role. Starting this program at the beginning of COVID-19 was challenging, but by being flexible and working through it, the framework for the East Mississippi Hub was completed, and I was able to recruit volunteers for the following unique COVID-19 initiatives. One of them was the Lauderdale County School District's grab and go meal deliveries that took place in May. Dave, if you don't mind showing that video real quick.
Okay. It'd probably be helpful if y'all could hear.
Thank you, Dave. This initiative helped provide food security to some of the most vulnerable children in Lauderdale County. LCSD has food distribution sites, but there's a lot of reasons some of these kids and families were unable to travel to these distribution sites. A few other things, I assisted Extra Table in coordinating deliveries of pallets of free milk from Borden to several nonprofits in Meridian. With United Way, we implemented a book drive to benefit students of Meridian Public School District and Lauderdale County School District. We also created a care package delivery initiative for the at-risk population in Lauderdale County. Along with these initiatives, I'm also connecting with nonprofits in my coverage area in order to spotlight them, bring awareness to their missions, and connect them to resources and volunteers. Challenges that I'm seeing with nonprofits right now, especially in food pantries, is the upkick in needing to feed more people than usual in most cases. As far as volunteerism in my area, I've seen a steady increase in interest. I'm working hard to bring more awareness to the hub and what it has to offer so that I can keep volunteers busy and serving. I'm really excited about what the future holds for the East Mississippi region. As the partnership with the Hub, United Way, and Community Foundation grows stronger, I foresee a lot of positive change within our community. Our three entities are continuously working together and referring nonprofits to each other's resources. This fall, we are hosting an East Mississippi nonprofit conference where each of us will share a message. And by the end, our nonprofits will have a very clear understanding of what we do and what we can help them do in order to be successful. Sammy Main is coming to speak at this, and we're really looking forward to that. In conclusion, I look forward to working with those of you who have not met yet. I've posted my contact info in the chat box. Thank you all for listening.
Thank you, Casey. The work you are doing is incredible, and I love the video you made. We will have to get you on to do a training and tutorial for folks on how to do that, but it really is amazing. And as you all saw, thousands and thousands and thousands of meals and masks. And so really, thank you, Casey, for the work you're doing, and keep us posted. So with that, it is 10 o'clock on the dot. I just want to highlight before you all disappear, again, please sign up for some trainings. I really want to make sure that we get those resources to all of your organizations who could use support. Thank you for taking the time to be here, and just be safe, be well, and we look forward to connecting with you during our trainings and at our next weekly webinar. Have a great day.